So I'm presenting on genomic profiling of smoldering multiple myeloma. And what smoldering multiple myeloma is a precursor condition to multiple myeloma, which is a plasma cell malignancy. Smoldering multiple myeloma is kind of defined clinically in most hospitals around the world right now, and the treatment of care for smoldering is sort of a wait-and-watch approach until these patients in the smoldering stage eventually develop symptoms of multiple myeloma. Recent studies have also shown that treating patients that you deem to be high risk in the smoldering stage could benefit from therapeutic interventions. So it's really, important that we're finding patients in the smoldering stage, determining if they're high risk, and then kind of figuring out what treatment would be most appropriate for them. On the other hand, if you treat everyone, that could also be really bad because they could have toxicities with treatment, or it's financially incompatible. So it's an important problem to figure out the right balance. The approach we took was so currently, the risk models for stratifying smoldering patients rely predominantly on clinical features that you could see in the clinic. But there have been more studies recently that have shown that smoldering is a genetically mature disease, and there are a lot of alterations in the genetics and genomic space that could be predictive of this progression from smoldering to myeloma. So what we wanted to do was, perform kind of a comprehensive genomic profiling of 214 patients and see if we could identify risk groups based on those genomic features rather than clinical ones, and see how they compare to the clinical phenotypes. And what we did in fact find was, when we did this in our cohort, and we also used 2 external validation cohorts, the genetic subtypes that we were identifying did find some patients in our high risk groups that did have a higher risk of progression, even when the clinical model said that they were at an intermediate risk. And on the other hand, we did find patients that were at a lowest risk of progression when the clinical model said that they were at a high risk of progression. So we believe that this genomic profiling is adding just a little bit more to that picture in clinical stratification.